Hey everybody, welcome back to Life Be Lifing, where we talk about real stuff that actually affects us financially. So I have not read this article. We're going to read it together. I'm going to skim through it, but the title was very interesting to me. So let's go ahead and go through it. Mark Cuban asks, why insurance pays $2,500 for an MRI when a center down the street charges only $350. You already know the US health insurance market is a scam. I think it's a scam for sure. Like by now, I feel like everybody probably thinks it's a scam. Mark Cuban has always been very vocal about what he thinks about health insurance in the States. And he does have, I think, like a pharmaceutical something to give discounts on meds. So of course, keep that in mind as well. But he has really been an advocate when it comes to making sure at least we get some type of affordable meds when we need them. Whereas other private entities they don't care, and they have a monopoly on everything, and that's a whole nother rabbit hole. Maybe we'll go down that rabbit hole one day, but as for now, let's go ahead and focus on this article. So billionaire entrepreneur Mark Cuban isn't letting the absurdity of America's health insurance costs slide, not when a scan could cost more than some used cars, which is ridiculous. Explain to me why the insurance company will pay $2,500 for an MRI when there is a center down the street that will do it for $350, he wrote on X. I'm all for PBM reform, he wrote earlier in the day, but realize that the biggest PBMs are owned by the biggest insurance companies. They are too big to care. Employer, patient, state, hospital, physician. If they can charge you, they will. That's when a user pushed back, arguing that insurers simply pay the bills submitted by the providers and aren't the ones setting sky-high prices. Cuban's response, the message was clear. The insurance company have no incentive to control costs when they benefit from a bloated system. And to Cuban, it's not just inefficient, it's exploitative. They aren't required to be. And that is the point. They increase prices. Cuban, who co-founded low-cost pharmacy platform Cost Plus Drugs, has spent the past few years attacking middlemen and opacity in the healthcare system. His strategy has focused on cutting out layers of bureaucracy that pad prices without delivering value. He also been vocal about pushing Congress to force PBMs and insurers to divest their overlapping interests, calling for greater transparency and more consumer leverage. And with the healthcare premiums continue to rise across the country, the disconnect Cuban exposed isn't just a rhetorical gotcha. It's a snapshot of why Americans are paying more for less. Even if you're not the one footing the bill for that overpriced scan, you're still paying for it through bloated premiums, rising deductibles, and out-of-pocket caps that just keep climbing. For high earners trying to build real financial stability, it helps to see how those hidden costs ripple through everything else. Yeah, and that's basically that. And like I said, he's always been very vocal when it comes to health insurance costs in America. And me, being that I've been living outside of the US for this month in January, it makes it 4 years that I've been living in Dubai. And just me traveling back and forth from here and mainly in Europe. I don't go to the States often. I think I've been to the States probably like twice, 3 times max since I've been here. And it's just very frustrating how now a lot of Americans are starting to open their eyes and realize, okay, we are being duped. We have the shorter end of the stick. But it's funny how some just don't really care about it, because the push to more affordable healthcare, the push to overthrow that whole system is just not there, where you have people in France who are trying to riot because they're going to increase the retirement age. They're like, we're not having it. It's one thing if the government is doing it for your best interest, but it's another thing when you clearly see that you are being duped and they're just taking advantage of you. A lot of people are not, they don't, I don't know if it's lack of caring. I don't know if it's just laziness. I don't even know if it's not knowing. One time I was in Atlanta and I was having some skin issues. I wasn't sure what exactly it was. And I found out it was just the water in Atlanta that was not reacting right with my skin, because every time I left Atlanta, my skin would be better. Once I returned, I would get spots and splotches on my skin that looked very sickly. So I just realized it was literally something in the water. So I went to the dermatologist to see what was going on, and he asked if I had insurance. I think there was, of course, a fee to see him first. I don't remember what it was. Normally, they kick off all the dependents off of their parents' healthcare insurance. At that time, I think I just got off of my parents' insurance, and I was an entrepreneur. I wasn't really knowledgeable on the whole shopping, the insurances every year. So I think I was lapsed between insurances at that point. And I was like, no, I don't have. And they quoted me like $100, I think, $100-something in order for me to be seen. I asked them, I said, how much would it have been if I did have insurance and you guys were going to bill? They're like, oh, it's going to be probably over 1K. I said, what? Are you serious? They're like, yeah. And that's the average? Yeah. And at that point, I realized this is all a scam. Like Mark said, you have huge premiums. You have all of these other costs that goes into having this insurance, holding an insurance card and being insured is not cheap. It's very expensive in order for you to have insurance. Not only you have a copay, but you pay monthly. And then once you actually need it, they're going to do everything they can in order for them not to give you. Because I remember when I was in the dental field, in the office I was in, it was a private office. It had somebody specifically sitting at the desk to handle insurance because insurance was just so hard to deal with. They will not give you your coverage. It's pulling teeth in order for you to actually get what the premiums that you've been pouring in this entire time. So you could sit here and pour in premiums for 5+ years. As soon as you need them, they're going to be like, oh, well, technically this doesn't count into your coverage. All of this is extremely frustrating to know that there are other parts of the world that take care of their citizens very well and provide them with the basic essentials in order for them to live and for them to have a standard life. It's so sad to know that one of the most popular, one of the richest countries doesn't have that, does not support that, does not give those basic needs to their citizen. And it's just very telling that just because your country has money, that doesn't mean the intent is there, because there are so many other countries with smaller GDPs, with that prints out less money, that spends less on average, and they are doing everything they can in order for their citizens to have the basic needs that they need. So it's very frustrating, and it just makes me sick to my stomach. Companies are easily getting away with this with not much pushback, and now we have people in office that really don't care. At first, we had people in office in and out that care so much, cared a little bit more in order for them to, pass some laws or try to ease the bleeding. But now there are people in office who really don't care for others at all and are pushing people out of healthcare insurances because their friends own these type of businesses. But let's go ahead into some insurance TikTok reactions.
How much does health insurance cost in America as two people who have moved here from overseas? Well, for my wife and I, we're 36 years old, neither of us smoke, and we're spending $1,300 per month. But there are aspects of this that I think are really going to shock you, because they certainly shocked me. I assumed that through spending that, I wouldn't necessarily have to pay a great deal towards our medical bills thereafter, but actually, I can't believe how untrue that is. So if you want to see a doctor, that's $50. If you want to go to a specialist, that's $100. If you have an accident and need to go to ER, That's $1,000 with the insurers paying everything on top. However, if you need to stay in overnight, that's $2,500 per night with the insurers paying everything on top. So if there is some peace of mind in health insurance, it's the fact that your annual exposure is capped. So in our case, on top of our monthly premiums, the maximum we can incur in medical bills each year is $9,200. Beyond that point, the insurers pay everything. So I suppose at least you have some peace of mind that you're not going to completely bankrupt yourself, hopefully. But I was really surprised by quite how much you still have to pay for your own medical bills in spite of paying this high monthly fees. Of course, there are different tiers of packages. Ours is a silver package, so it's probably fairly middle of the road. But if you want to pay higher monthly premiums, then of course you don't have to pay quite so much when something happens, and vice versa. For many people coming here, obviously and thankfully, health insurance will be included and provided as a work benefit. So in that case, you probably don't have to worry about a lot of this in quite the same way. But if you're coming here without a job, with the intention of trying to find a job, or you're self-employed, you're going to have to pay for all of this. And as you can see, it's really quite expensive.
Let's see what the comments are saying. Someone said, that's awful. So thankful for the NHS, which is in the UK. Someone said, LOL, $50 shock you. Wait till you have a medical condition and the medicine is in the hundreds, or any special surgery. Yeah. That's what he's not putting into play. He said, oh, okay, well, $50 here, $100 here when it comes to the copay or the visit fee. Yeah, but what about meds? That's not included. He did mention if you are an entrepreneur, then you got to pay that out of pocket. And I remember when I had health insurance in the States, because I didn't have health insurance, do you remember that I said that lapse time at the end for taxes, I had to still pay a fee because I didn't have the health insurance. So if you have it, you pay. If you don't have it, you pay. I don't know if that's still the case, but I know that was the case when I applied. One says all true, but your taxes here will be much lower. Everybody seems to forget that. Taxes where in the States? Wait, what? They're 10% lower than the UK and actually marginally higher at mid-range brackets. Your food is more expensive, mortgage rates are higher, and your salaries are only 1.5 times those of the UK. It's not as good as you think it is. Your cost of living is way higher. Yeah, and that is actually the truth. Even though those in the UK salaries are much lower than the States, they do get a lot of incentives that makes their cost of living a little bit softer. They have a lot of government assistance. There's a lot of things that the States have that are positive. Okay, I'm not, dunking on the States, but there are a lot of false narratives when it comes to the States versus other countries. When it comes to taxes, when you have state tax, federal tax, food tax, clothes tax, e-commerce tax, every single type of tax, it doesn't really become much cheaper. And then, like he said, food is more expensive. Oh my goodness, for you to get fresh foods, for you to get fresh meat, for you to get organic, for any of those things that should be just cheap. You understand? Not saying they should be free, because it does take labor for farmers to get them together, but they should be way cheaper than what they are now. Someone says, true, cost is higher, but when I lived in New York, my salary was 2.3 times my UK salary. That makes a big difference. It only makes a big difference if you're sending money back to the UK. Because, excuse me, even though it's 2.3 times higher than the salaries in the UK, you know how expensive it is in New York? In New York, cost of living makes absolutely no sense.
I mean, this medication isn't medically necessary. My doctor said it is. and I'm dying. What do you mean this is out of network? My in-network doctor referred me to the specialist. How in the hell is this $10,000? I was just in a waiting room. I didn't even see anybody. What do you mean you guys aren't covering this? I called you before I did these services, and you guys specifically told me that you would be covering this. No, I don't want to do a 30-day appeal. I want you guys to cover this like you said you would. So because I'm already sick, you guys won't give me the insurance? That's kind of what I need the insurance for. I give you guys a ridiculous amount of money each month, and you guys aren't even gonna cover a $300 claim? No. Why is the person who's in charge of my appeal not a doctor? I kind of feel like it should be a doctor who's in charge of my appeal, since it was a doctor who was the person who told me that I should be on this medication. Why is a guy who's never been to college the person who's handling my appeal? I feel like the doctor who told me I need this medication knows better. You are going to get sick someday. It's not if, it's when. And when that happens, your insurance company that you pay a bunch of money toward every month is going to do everything they can to not pay for your care. I will never understand why people defend so passionately a system that so passionately goes out of its way to not care for those people.
Okay, back to the whole health insurance thing. So let's do a pretend scenario to kind of help you understand how it works. So let's say you want to go get your nails done. Okay, you go to the nail salon, you see your nail girl, she does them, and at the end she says that'll be $80. And you say, oh, I'm not paying. My boyfriend is going to pay. Send him the bill. This is very simplified, but stick with me. Nail salon's like, okay, sends boyfriend the bill. He calls back and says, I don't really think that the color you chose was necessary for the beauty of the nails. Also, I'm going to reimburse you at 80% of what you asked for instead of 100%. Nail salon's like, what? But I mean, what are they going to do? You know? That's how health insurance works. So normally when we go to the nail salon, we're paying directly for that service. When we start involving a third party health insurance, things start to get weird. So the nail salon is forced now because they can't say, hey, your manicure should be $80 or your manicure and pedicure is going to be $80 and you're going to pay me that at the end of the services. Now that we've involved this boyfriend who we can't rely on to reimburse us at the asking price, things get weird. So now the nail salon's like, maybe we need to up our prices because we know boyfriend is going to reimburse at 80%. So then by raising the price and getting 80% of that asking cost, we're hitting that threshold that we planned on hitting in order to reimburse ourselves, pay the bills, cover the cost of the dip, all the stuff. You get what I mean? So things get really complicated. So then everybody's coming in and they're saying, oh, send the bill to my boyfriend. Send the bill to my boyfriend. So then whenever someone comes in and is like, my boyfriend's going to pay for it, but I'm curious to know how much this service is going to cost. And the nail tech is like, I don't know, because we have a different agreement with all the different boyfriends out there. So I could give you a self-pay price. I could go right now. I could look up the code for doing a dip manicure on 10 fingers, and I could tell you what the self-pay price is. But because we've negotiated all these different contracts with all these different boyfriends, and you're planning on your boyfriend paying, I don't know how much it's going to be. That, in a nutshell, is how health insurance works, okay? That's how health insurance has really confused the doctor-patient relationship.
Okay, that was a good analogy. I didn't know where this was going in the beginning, but it makes so much more sense. But let me know what you guys think about this topic. It is a very important topic for all of us because we need health insurance. We need to be taken care of by the doctors. But all of these middlemen are making it so hard for us to be able to afford the health care that we need. So let me know what you guys are thinking down below, and I will see you guys in the next video.